So let's talk about people who have a bad history in their previous pregnancy. For instance, you had induction of labor and labor progressed actually. Probably there was a lot of pains during the processes and you ended up having episiotomy. Some people had just one side episiotomy, lateral, while some others had bilateral. This may have impacted a lot in your mind and how you feel about delivery. Gosh, you may have passed through a lot of pains. Of course, it's supposed to be sutured under local anesthesia, and after everything, the healing came. Some have a bad experience of having an episiotomy site infection, let's say wound breakdown, as we publicly call it. Now, all this thing could lead to post-traumatic stress disorder even after you have recovered. You see some women battling with this pain and postpartum depression. You'll see some other one not being supported by anyone. Some were not actually given that kind of love that they should have from family, friends, or probably their partner, and it could impact a lot in how they see themselves. Now, you see, this set of people usually have some terrible outcome when it comes to sexual life with their partner. It comes up. Another angle, some women will end up not even agreeing to have any sexual intimacy with their partner. And some of them, when you take your time to ask why, they tell you, I never did ready for pregnancy. The thing why I see for the last one, I no fit try them again. It's not that they don't want to, naturally want to have sex, but a sexual intimacy, it kind of give them a trigger to the trauma they passed through during the delivery. And some persons also feel like next labor is going to be this way. Of course, no. There are so many reasons why a woman could have episiotomy, which we're going to talk about in the next phase of our video. There are a lot of issues that comes with childbirth. There are issues of, there's an issue of post-traumatic stress disorder. There is depression. We call it postpartum depression. There's also hysteria, but most of these things have triggers, and the triggers are linked with physiological or psychological pressures that they went through during pregnancy, while having their baby, and after delivery. So it is high time we let people know that most experiences that a woman is having during birth, after delivery, is associated with trauma, stress disorders that have affected most of her hormones, making them be on a high side, controlling their mood, their feelings, as well as impacting on their mental assessment of themselves, distorting their personal image. Self-image is now seen as, some end up seeing themselves as they are nothing. They don't see themselves as a valuable asset to themselves, not to talk of others. So in this video, I'm trying to analyze the expectations of people who see women who are having some of these disorders as if they are intentionally doing it. Some kind of are asked to